Everyone, thank you so much. Everyone, thank you so much for being here. Welcome to our Colorado Health Foundation poll. And this is a Colorado Health Foundation. My name is Virginia Garcia Pinnick, and I'm a bilingual consultant for polls. And I'll be facilitating today. Before we get started in this presentation, I would love to go over a few things that we have to consider to have a better experience. First of all, please stay muted during the whole presentation. This will minimize the noise that we may experience, the background noise. This is going to be recorded, so you'll have action to the recording once we're done. Please feel free to share in the chat box your questions, comments, or anything else. And whenever you do use the chat, please select the option in the drop-down menu to all participants and panelist members. This will ensure that we can all see your comments and questions and that someone from our staff can assist you. We'll try to help you with as many questions and comments as we can. If you have any questions with IT, please let us know. And if that's the case, just chat members of the panel, and a member from our staff will be able to assist you. We'll also honor Hispanic Heritage Month, and as I said, we'll offer this meeting in Spanish with English interpretation available to English. Before we do continue, I would like to introduce you all to B. Torres and Valentina Sarmiento Cruz, for everyone to learn a bit about language justice and how to use
Hola, buenos días,
interpretation.
muchas gracias. Hello, good
Hi
morning,
everyone,
everybody.
good morning.
Voy a decir esto en inglés primero y luego en español. I'm going to say these instructions in English and then in Spanish. Good morning, everybody. My name is B. Torres. My pronouns are she, her, ella, and I am one of your Spanish interpreters with the Community Language Cooperative. I'm joined by my colleague, Valentina. We want to thank you for your commitment to language justice. Language justice means that everyone should have the right to speak and be heard in the language of their hearts. Therefore, Valentina and I will be interpreting this meeting from Spanish to English. In a moment, well, actually, our interpretation is enabled now. And so you should see at the bottom of your Zoom screen the interpretation icon. If you are fully bilingual in both English and Spanish, you do not need to select a language. However, if you are a monolingual Spanish speaker, a monolingual English speaker, you will need to choose a language. Please click on the interpretation icon and select either English or Spanish as the language of your heart. Please remember to speak at a conversational pace so that Valentina and I are able to provide an accurate rendition of your message. And should you have any technical issues with interpretation, please feel free to type in the chat so that we can troubleshoot as we go. I'll now repeat these instructions in Spanish and then we can continue. Hola, buenos días. Yo soy Vi Torres, mi pronombre es ella, y estoy aquí con mi colega Valentina por parte de la Cooperativa Comunitaria del Lenguaje. Les agradecemos su compromiso con la justicia del lenguaje, lo cual significa que todas las personas tenemos el derecho de hablar y ser escuchadas en el idioma de nuestro corazón. Valentina y yo interpretaremos esta reunión del español al inglés. La interpretación ya está activada. Usted va a ver el icono terráqueo en la parte inferior de su pantalla de Zoom. Por favor, haga clic en ese icono y elija el idioma de su corazón, sea el inglés o el español. Si usted es bilingüe en ambos idiomas, no es necesario escoger solo uno. Le recuerdo que por favor hablen a un ritmo de conversación para poder brindar una interpretación precisa de su mensaje. Y si están batallando con la interpretación o tienen dificultades, por favor asegúrense de escribir en el chat y podemos arreglar el asunto mientras continuamos con esta sesión. Muchas gracias, ya comenzaremos. Thank you very much. We can go ahead and begin.
And this seemed like someone in an international flight. This was amazing. I was wanting to do like, okay, let's take off. Okay, wonderful, like an air stewardess. But anyways, thank you so much, B. Thank you so much, Valentina. And now I'm going to introduce you to Leslie Fajardo-Fo from the Colorado Health Foundation. Leslie, good morning. Welcome. Hi, Virginia. How are you doing? Thank you so much for having me here. I'm Leslie Fajardo-Fo, and I'm the official here of programs at the Colorado Health Foundation. And it's This is a great opportunity for me to be able to share a bit about what we do here at the foundation, the work that we do, and the commitment that we have. And at the Colorado Health Foundation, we work to have all inhabitants of Colorado, all Coloradoans, to bring them health. And this associations, this can be through nonprofits, through government institutions, universities, and also community-based organizations. We try to promote public policies in the sense that they're more equitable or that they are also looking to help out with the community. And of course, we believe that everything should have some research and context, and we should have a knowledge about what the community is needing and what the work is being done. So this is sort of our fundamentals for work. At the same time, we have three cornerstones that we know and that we want to serve Coloradoans who have less power, less privilege, and of course, less income. And we want to prioritize Coloradans of color, either in urban or rural areas, and work with people that are limited in their access to services. At the same time, we also believe that the community needs to be represented and they need to be able to participate and support different initiatives. And so when we look at a grant, we want the community to be fully involved in the work and in the services that will be offered, because we need to know that this is responding to their needs. And lastly, we also want to know or have an idea about how this work through the projects, how this is bridging gaps in our communities. So as I said, our commitment is in filling in those gaps, and we are very solid in our work through equity, but also we believe that it's necessary to bring in racial justice. So we also need to provide as many options and opportunities to people of color, just like myself. So here at the foundation, we are committed to change, to transformation, and to supporting our community. Now I'll pass the microphone back to Virginia, so that she can share more about what the polls is and how we'll be using this tool to understand better and learn best what Coloradoans can share. Thank you, Leslie, for this overview. Thank you for all of you that are joining for the first time and wanted to learn more about what the Colorado Health Foundation does, what their work is day to day and year to year. So thank you all so much, people that are still joining. Thank you for Una Mano en Esperanza, Promotoras, also the Arturo Vargas organization. Thank you all food banks from all over Colorado State that are joining today. So thank you so much. And so first of all, we're going to be talking about the results of polls and the Colorado Health Foundation. So some of you might be wondering, why is a Colorado Health Foundation, a health foundation, is doing a poll? But most of us, we think of a poll as a way of predicting like a presidential winner in their elections. However, polls is about taking the community's polls to listen to what's happening to Coloradans in all of the states, with all racial and ethnic contexts and backgrounds, and all of their lived experiences. We also want to hear out their concerns, their worries, their perceptions and beliefs, and their life priorities. We do this because we believe that the Colorado Health Foundation, just like the Colorado Health Foundation, that better health starts with understanding everyone and hearing from everyone. And everyone that lives in Colorado this year, we've had conversations, 20-minute conversations with 2,639 Coloradans, including with 462 Hispanic or Latinos that identify themselves as such. And so with that universe, that sample, we were able to see certain patterns from the community, and we were able to approach them and approach their thoughts or different people's thoughts. And that way we would understand their realities better. In the coming 90 minutes, we'll be sharing with you all what we learned, what we heard from our Hispanic and Latino members and neighbors. And I remind you all that we are delving into perception of Hispanics and Latinos without disregarding the rest of the people that took the poll. You'll be hearing out exactly what we asked and what we got back from Hispanics. And polls is like a mirror, honestly, because it's impartial, it's objective, and the idea is that it reflects precisely the priorities, the concerns, and the experiences of Coloradans. I wanted to highlight for those of you that are meticulous in terms of the Hispanic and Spanish languages that we'll be using the terms Hispanic and Latino interchangeably to refer to ethnicity, culture, and identity. However, we acknowledge and we recognize that these mean different things. If we are going to be using them interchangeably as a general reference, we do understand the distinction and the differences in life experiences that identify with these or other cultural categories and tags. I now have the pleasure of introducing you to Enrique Castillo, who's a researcher and the president of Castillo and Associates, and is one of the brilliant minds behind polls for the Colorado Health Foundation. So Enrique, good morning. Thank you, Virginia. Thank you all so much. Thank you for your attention and for being here. And as Virginia was saying, we're going to be sharing our polls results. And so I'll be sharing a bit about the methodology of the poll. So us, through the Colorado Health Foundation and through polls, we did the poll, and we did this from April 8th through May 3rd of this year, 2023. And we did this through two different organizations, FM3 Research and Newbridge Strategy. And these are bipartisans. That means that we have people that work with Democrats and another group that work with Republicans, just to have a very general presence and not say that we have a political tendency. And the poll is a dual poll. We do it via phone and online with people that live in Colorado. From the 2000 and etc. people, I don't have that number at hand, we found 462 people, adults, who identify as Hispanic or Latino. And from that, the way that we communicated with them was through telephone interviews or online interviews, and we invited them via phone, email, and text so that they could help us with the poll. Collecting data was done via interviews, as I just mentioned, or through online interviews. So we have both options to be able to collect the data. And that way, we have information that we compare to other polls. We did the poll in 2020, 2021, and 2022. And so now in our fourth year doing the poll, we were able to focus and talk to people in our country, Hispanic or Latino, and we do the survey both in English and in Spanish. And so we were able to answer in either language as needed. And a bit about how the maps, the Colorado regions, we distinguish the way in which we talk to these people, and it's just based on different parameters. Most people are in the Denver metropolitan area, Denver Metro, but we're also able to talk with people throughout the state. We have these percentages where we notice that in the plains, Eastern Plains, we try to incorporate everyone. We didn't just want to talk to a certain group of people in a certain region. We wanted to have everyone's voices so that people could represent what they want to share. So a bit about how this is the full state from the Western Slope to Eastern Plains, from south to north in this context. We noticed, or here are the top concerns. This is where we're going to start. What are people's top concerns for Hispanics? So we asked the question at the beginning of the survey, and we asked everyone, in your own words, and if you have words of your own, what is the most important issue facing Colorado right now? And what we saw was that cost of living or inflation and housing affordability. These concerns were for today in a day-to-day, what's keeping Coloradans awake? And this is, of course, one of the reasons that we should see and consider these ideas. So we are noticing that cost of living and housing affordability, and then economy and jobs. And we notice that after that, it's a flow of what we see, that these topics are, homeless people, and then public safety, government and politics, and then at the very end, we see traffic and congestion. And as we are noting here, these are invariably open-ended questions. And so this is cost of living and housing affordability are the main concerns. And then we move on to see what these concerns are. And we notice that 9 in 10 Latinos rank the cost of living and the cost of housing is a very serious problem. And so very serious in terms of, well, we noticed like, okay, what's the shift going to be? What's the change? And why is that the reason? What are going to be the following ways in which I can address this kind of concern? And so at this point, we saw that 64% said that it was a very serious problem currently. Compared, obviously, with the cost of housing, it's 58, and then we see that, 54%, and then we see that homelessness is 58%, but what it says here is that it's more than half of the people in the state feel that these are issues that are very serious to the state and to them personally. And so we also notice that immigration and illegal immigration are not something that is considered very important currently. It might be something that decreased in the past years, but we notice that these things, more of the cost of living rising and the cost of housing rising, are of more concern. Similarly, we were saying, and we noticed that households with incomes under 75K per year are the ones that also express more concern on a wide range of issues. So what we notice is that if the household is below the $75,000 per year, we notice that the rising cost of living is still a concern. The cost of housing as well, for either buying or renting, is still a concern. And at the same time, homelessness is still a concern. So we notice that at this point, even if we think of household incomes, yearly housing incomes, this is still, the same concerns are still present. At the same time, we can see that even if households have incomes above $75,000 per year, we still noticed that 84% of the people still think this is of concern. And so as we were looking, it's still a great issue, it's still a concern. The rising cost of living, the cost of housing, and homelessness. These are considerable concern or high priority concerns. Based on the region, we noticed, so we started looking at region, disability status, and language spoken. We saw that at the front range, we noticed that 92 to 85 to 90 something percent are still finding that the rising cost of living is is an issue. The cost of housing and homelessness are still also high on the list. And so we were looking and asking about this topic, and we're still thinking about this concern. And at the same time, people are considering drugs and drug overdoses, crime in general, and mental health are other issues that start to come up. Drug overdoses, crime, and mental health, and also gun violence. So we delve into these a bit more. These are more frequent, and we notice how these increase. With this, we see that more than 2 out of 5 Latinos have been treated unfairly in interactions with law enforcement. So this is police force, for instance. This is telling us a bit about what this variant is. If this interaction is with law enforcement in one way or another, if it's police. And the other thing is also when they try to rent or purchase a place to live. And so they feel that they have been treated unfairly and haven't had access to a type of rent or to have access to purchasing a home at the same time when they seek employment. And so these types of interactions that people have with law enforcement, trying to buy a home or interacting with government agencies or services, or when seeking healthcare services, these are, of course, issues that people have felt that they've been treated unfairly. Now, here, we notice that it's more likely that women, Latina women, are more likely to indicate knowing someone who has experienced some form of unfair treatment. So we have the full segment of the demographic, and then we have Latinas women that have felt that they've been treated unfairly. And so we've noticed that these is more prevalent for women within our demographic. Then speaking about Colorado Latinos that live with a disability report knowing people who have experienced a wide range of unfair treatment. And similarly, this is when interacting with law enforcement, when trying to rent or purchase a place to live, when seeking employment, when interacting with government agencies or services, and when seeking healthcare services. Now, we were talking about women, now we're talking about people that live with a disability, and it's a higher percentage that have felt that they have experienced unfair treatment. Something else that we're talking about is cost of living. We were discussing these rising costs of living, and how do we approach this? How do we feel this, or how do we resolve this? How do we approach it? We see that most Latinos in Colorado say that they are no more than just getting by financially. This means that on a day-to-day, they're not sure of what they're going to do to get by. But we have here that 15% say that they live comfortably with increasing savings, or that they're barely increasing their savings. 30% live comfortably but not increasing savings, so they can't foresee anything they might need in the future. And 35% are saying they're just getting by financially. But day to day, they say that, well, I'm trying to see what I can do from day to day. So what is interesting is how we conceive of our savings, but at the same time, whether we have the ability or that little, those savings, if I might need them in the future. Here we see that more than 2/3 of Latinos with household incomes of $75,000 say that they're just getting by. So what we see is that they're barely getting by. They're trying to see on a day-to-day how to deal from one day to the next with these numbers. we see that while they're just getting by economically, most of them are saying that they cannot save up, they cannot see towards the future, they're not able to have a little margin where they can think of the future or of themselves or their families. Also, Latinos say that their financial situation has worsened in the past year. So if 42% think that they're about the same, still that 37% indicate that things are worsening, that they don't see any improvement towards the future, and this is a big concern. Because if they're in a situation where they feel like they're stable but cannot move forward, what does that tell you about the future for yourself and for your family? With that, this is especially true for people in the lower economic scale that live with a disability or that live on the front range. So if their income is lower than 75,000, live in the front range and at the same time live with a disability, they feel like things are worsening for them. They do not see any clear pathways into improving their situation, and things don't seem to be able to improve. At the same time, they're concerned about not having employment next year. This is a concern that we see in a total of 50%, that they might not have a better job in the coming year. So when they're, or not a better job, just a job. And so this means that they won't be able to assist their family, bring food to the table, or assist their family with rent. So they are not finding a way into paying their costs. Most of them are concerned also about having food constantly, and this is a concern of theirs. Almost 53% have indicated that they are concerned about putting food into their families on a day-to-day.
Similarly, nearly 2 in 5 people have postponed medical or dental care in the past year for the same reasons. It could be the high cost, it could be having to choose putting food on the table or having other costs. But if we can see here in these high costs, about 60% or 62% have postponed medical or dental care in the last year. And this is something that's a huge consideration when we talk about what we can do to address this specific topic as well. Especially, we need to take particular note to those who are under 35 years of age, who have lower incomes or live with a disability. These folks are the ones who suffer the most when we talk about this situation. When we talk about postponing medical care, whether that's medical care, dental care, or any sort of general care. But when we talk about mental health, this is another issue that is concerning. That in the last 12 months, folks haven't been able to get this type of treatment. From here, we see that 3 in 5 think that it's easier to enroll in programs that provide financial assistance, and it would be very effective in addressing these costs of living that we have reviewed. These issues of concern that we've reviewed today. And so when we talk about these issues, these areas of concern, there's a folks responded to this question, at least the majority responded, saying that should be easier for low income folks to enroll in programs. Perhaps increase the amount of tax credits. These are some topics that were addressed that could be an effective way to address these concerns about house costs of living, and to be able to give folks more opportunities when it comes to these various issue areas. Another topic that's mentioned, this is number 3 in terms of area of concern, is housing. And so this is a topic that has been spoken about a lot throughout the state of Colorado. And we see that this is a topic that is coming up over and over again. I don't know if this is because of rent or because of purchasing homes, but when we talk about housing and taking this into consideration, more than 3 in 5 Latino parents are very worried about whether their children will be able to afford to live in the state of Colorado. And so, what does this tell us? This tells us that right now, maybe you can have the ease or the opportunity to have a home. You have a roof over your head. But what about our future generations? What's going to happen to them? If the cost of rent, if the cost of living continues to increase, this is going to be a very big area of worry. 62% of folks are indicating that they are very worried about this. And so we need to take these numbers into consideration, really look into them. And so 2 in 5 Colorado Latinos are worried that they may be unable to afford housing in the coming year. Looking at these increases in costs, then we feel that about 60, it looks like about 60 some odd percent don't know how they're going to do this, how they're going to be able to afford housing in the coming year. If there's an increase in their rent, if it's going to increase by a certain percentage, how are they going to be able to make up that percentage with the income that they have? Similarly, most Latinos who live with incomes under $75,000 or folks who live with a disability are worried about being able to afford housing. These are really high numbers that we're seeing. About 50, 60% of folks are with these types of incomes are worried about how they're going to be able to afford this, how they're going to be able to increase or at least pay this rent or their mortgage month to month. And again, almost 9 in 10 Latino renters aspire to own a home. However, only 1/3 expect to be able to afford to make that a reality. So this aspiration exists to be a homeowner, and they would obviously like to own a home, but the likelihood of being a homeowner is very unlikely. And the reason for that is because they have to take into consideration the high cost of living, the high cost of a mortgage, and at the same time, we're seeing that they're asking themselves, how are they going to be able to do this? You have a family, you have to put food on the table. How are you going to be able to purchase a home? And so the aspiration is there. And I think aspiration, as all Latinos, as all Hispanics who come into this country, we have this dream, right? The American dream to be able to own a home. And we see here that this is a little bit aggravating that folks aren't able to purchase. We see that 2 in 5 Colorado Latinos have worked multiple jobs or more hours than they wanted to make ends meet. When folks aren't able to stretch those dollars, they have to look for a second job or look for hours. Maybe they share housing with other family members or they have roommates to be able to make ends meet in a more efficient way. So we see here that folks are working multiple jobs or sharing housing or having roommates or perhaps moving because they couldn't afford rent or mortgage. These are topics that are coming up over and over again when we talk about housing or when we poll folks about how more than 4 in 5 Latinos view property tax cuts or rent stabilization as effective ways of addressing housing costs. And so here you all can see some of the ideas or measures that we could consider. And so to impact that housing cost, about 86% indicate that reducing property taxes for homeowners could be one of the ways to increase affordability. They feel that perhaps the landlords, they have to pay higher property tax. And so maybe if we lowered those property tax, then perhaps that would lower rents as well. Um, there's also a suggestion here to not increase rents too quickly on current tenants. They feel that the rents are increasing at a percentage that is much higher than what they're used to. And we could also require developers to build housing for people with lower income levels so that people are able to have access to housing at different income levels. So here we have a variety of different options, a variety of different ways that could be realized so that we could provide some solutions to the housing crisis or the housing costs. The fourth topic that we notice that's a concern is healthcare. So this topic of health, the topic of any sort of medical attention, here we see that majority of Colorado Latinos worry that someone in their household will be without health insurance in the following year. This concern or this worry is almost half of Latinos feel that if I don't have health insurance, if I am without coverage, what am I going to do next? How am I going to be able to maintain this level of health of myself and of my family? Similarly, two-thirds of Latinos with household incomes under $75,000 voice the same concern. So we noticed that people between the ages of 18 to 34, who majority women, they feel that this concern, this worry is much higher than the other increases that we were noticing with that same demographic. Between 3 and 5 Colorado Latinos report experiencing mental health issues over the past year. This is a very interesting topic and a very concerning topic because mental health gets worse when we talk about financial insecurity, about paying for housing, paying for food, investing in your future. So when we talk about mental health, it continues, the strain builds upon itself. And 3 and 5 Latinos in Colorado are reporting this concern over the last year. And among those who are experiencing mental health issues, most of them have talked with a friend or a family member. And about 76% of them have talked with a family member or friend. And so this means that most folks know somebody or have a family member or a friend who have suffered through a mental health problem. We notice that this goes hand in hand with the other topics that we're talking about, and this is a topic that's very concerning when we consider all of these issues. Two-thirds of Latinos think that linking mental health services to physical health providers would be a very effective solution. Here we can see some methods or some actions. More than 80% of people believe that it would make it easier for people to receive mental health screenings and services at the same places where they get care for their physical health. This can be defined. So if I have to go to a second place to get mental health concerns addressed, that kind of decreases the efficiency, right? That creates another barrier. Another solution could be increasing government investments in programs outside of healthcare settings to prevent mental health and substance use challenges. And pairing mental health professionals with law enforcement to respond to mental health emergency calls. So if there's an emergency call, then our mental health professionals could go out with law enforcement to address those issues at the same time. So, what about the perceptions of state government effectiveness? We talked about mental health, housing, talked about employment, cost of living. And so, what are the perceptions of state government effectiveness in our state currently? We can see that most Latinos are somewhat satisfied with the performance of state government, but few feel that strongly. So we have different levels of satisfaction here. And you can see kind of this about 47% of folks are somewhat satisfied, but they feel that there's something else that could be done to get to that next level of very satisfied with the state government performance. Younger Latinos express much higher degrees of satisfaction with state government. 65% of folks between 18 to 34 report feeling totally satisfied. They feel satisfied with the way that the state government is working for them, this scenario. And folks who are older, between over the age of 35, are feeling satisfied, but not as much as we see in the younger population of 18 to 34 years. More than 3 in 5 Latinos rate political polarization and the influence of lobbyists as major challenges for state government. 65% report that they would like to see more action taken around this. Here you can see that this voice should have a little bit, the Latino voice should have a little bit more presence when we talk about political actions or political influence when it comes to the state government. There's a limited understanding among state policymakers about the needs of concerns of Coloradans like you or like this population. And so what are the needs of the Latino population or the Hispanic population, and how can the state government be more aware of those needs and address those needs? Folks are yearning for more open communication to be able to address the unique issues the Latino population face. More than 3/4 of Latinos perceive a variety of strategies for improving policy making as likely to be effective. So there's a certain movement that folks feel that something can be done, that these things can be addressed by the government in their political decision making. We see here that 87% folks feel that making information about how the public can participate and comment on policy decisions more easily available, this would be a way to make this more effective. There's also requiring state policymakers to consider the long-term financial impacts of their decisions. Why do we talk about the financial impacts? You know, we've seen it and we'll mention it again, that these are the decisions that could fundamentally impact decisions about housing, food access, food security, the cost of healthcare. These are decisions that have financial impacts that need to be considered for the future, and requiring state policymakers to consider how their decisions will impact different groups of Colorado within Colorado. So this is a little bit about what this is kind of a summary of what this presentation is. We have, for you all, obviously, we have the ability to kind of, you guys can see this presentation, but we want to open ourselves up a little bit more to questions through our contacts, Austin and Kyle. And we want to be able to answer any of the questions that you all might have about this Pulse poll for the Colorado Health Foundation. Thank you so much, Enrique, for explaining all of this data, all of this information. It's a lot of information. And so we are grateful for everybody who is taking the time to write their questions, write their comments in the chat. If you haven't done that yet, please take advantage of the time to write your questions and comments in the chat. We'll start answering some of these questions. And also, I'm grateful to everybody who has made comments and who is putting their input in the chat. William Knighty had a question, wrote in a question. How is it that how did we obtain access to folks? So how did we choose the participants of the poll who responded? And so the samples come from all over Colorado. We randomly select folks, and we want to take all of these responses as a collection, right? As a collective to measure these results from adults all over the state. And so we want to be sure that we're taking random samplings that is representative of the entire population. I'm not sure if you have another clarification or anything, Enrique? Yes, of course, and we invite folks to participate in this poll. It's completely voluntary. And so folks have the opportunity, you get that invitation, whether it's through email, through phone, and or postcard, and we invite folks to participate in this poll. And so it's a way that folks can volunteer to or voluntarily give their responses, and people have the ability to choose whether or not they participate. And so we send that invitation to folks, and they then are able to take part in the poll if they so choose. Another one of the questions that came up is, are you all thinking of surveying folks, immigrant folks? I think that was from one of our wonderful leaders in. Thank you so much, Maria, for the questions that you're writing in the chat. And the question is, are you all thinking of surveying a larger number of immigrants, Latino immigrants in the future? I believe that perhaps maybe the data would be different with a larger group. And then would you all uh, poll folks in the future of folks who have not been born in the United States? In that way, maybe we can divide data into different kind of different categories and different subcategories. Enrique, is there anything to add there? I think the idea there is that if we see that there's a growth in population, and then obviously we would need to increase the number of people that we pull. And so everything is adapted to the number of folks in our state. And I know that Colorado in the last year or so, there's been a recent increase in the population, the immigrant population in Colorado. And so perhaps for the next survey, the next poll, maybe next year, we would take into consideration those higher numbers of immigrants who are coming in and be able to sample that at to a larger degree. More than a question, we have a comment. Somebody expressed here that it is not easy to enroll in the public assistance programs. We have a lot of barriers, and unfortunately, everything that you all have presented is very true. We're not able to save money because we're living paycheck to paycheck. Another question, do you all have the data divided by region? I think that, yes, Mario answered that. Thank you so much, Mario, for being here from the Colorado Health Foundation and from Pulse. And the response to that is yes, we do have this data split up through different regions in Colorado. We have also the data split up into different regions, just like Enrique explained, whether that's the West Slope, the eastern slope, the mountain region, or I'm sorry, the metropolitan region. And so we have data also split up by county, especially for our larger counties. So counties that, like Pueblo, is a county that has a lot of diversity, a lot of cultural and identity diversity. So that one is split up as well. Yes, and I know we don't have a ton of time to review all of the details, but just like Virginia just said, yes, we do have different data or the data split up by region: Larimer, Denver, the West Slope, the east side of Colorado, Pueblo. We have all of these different regions that are split up, and if you all see in the data a little bit more thoroughly, you are able to divide it out and read that data depending on the county and region as well. Another question that we have is, has there been any information about the parents' concerns around college or around university costs? This is from Arturo Vargas. Thank you so much for being here this morning. And so the response to that question is that this survey this year, we did not ask specifically about concerns of higher education costs, but we know that these concerns around accessibility and the cost of living in our state are the main concerns of our Colorado residents who responded to this poll. Is that correct, Enrique? Yes, that's correct. And I think that this is one of the things that can be summed up when we talk about high cost of living. Like Virginia said, this was not a direct question about the cost of higher education, but I feel like when we talk about the concepts of, economic concerns or the cost of living, it could be kind of encapsulated in that. And so this could be a question that we could include in future surveys or future polls when we discuss or when we refer to higher cost of living or higher cost of higher education. Thank you so much for the questions that are still coming in through our chat. Thank you so much for being here at this presentation today and for continuing to make your comments and your concerns in the chat. This next question is about the division of age groups. And so are there groups that were split up for senior citizens, or is it just from 18 to 34 and 35 and up? And so I believe that on the dashboard, we're able to divide it up through different age groups. We have a dashboard, interactive dashboard, where you all can go in and search by racial or ethnic groups, by county, and by age. And so the website is copolls.org uh, dash results. And so, yes, kind of just repeating what Virginia said, in that interactive dashboard, you all are able to divide it up by ages, by regions, by language. And so there you're able to kind of play around with that dashboard and get the data that you are seeking in terms of the numbers of, or the percentages of folks by age group. This presentation is one where we focus primarily on the topics that we felt were the highest concern areas. But you all are able to go into this dashboard and you're able to see if perhaps there's more opportunity. If perhaps you want to do a deeper dive into the data, you're able to do so. Another question, Enrique, this is a question directly for you. Was this poll for only Latinos who speak Spanish, or is this for all Latinos, regardless of what their language is or what their culture is? And did you all ask about the educational level of respondents? Yeah, so this survey is done in any language. If you want to do it in English or in Spanish, you have the option then to choose to take this survey in whatever language you want. In terms of the demographic questions that we ask is age, region, educational level. So those are questions that are included as part of the survey. But if the question is, do you have the ability to answer the survey in whatever language? If you're Hispanic or Latino, you are able to choose whether you want it in English or in Spanish. Great, thank you. And again, thank you all so much for everybody who is here making comments during our National Hispanic Heritage Month. I have a question for Leslie. Leslie, if you are able to join us here in this virtual space. So the question has to do with how do these results influence or affect folks? How do these results influence or affect the work at the Colorado Health Foundation, and what can you all do regarding these issues? Thank you, Virginia. This is a great question. So here at the foundation, we always have a goal. And the goal is to know what's going on in our communities. We want to know what our communities think, how they experience different challenges, and beyond that, who else is working in these spaces and who is collaborating so that we can work together to solve these problems. As a philanthropic group, we need to partner with other agencies to be able to address these issues. And so when we get all of this information and when we know more, then we're able to have more internal discussion. I know that the solutions aren't developing as quickly as folks want, but we want to know everything that's going on in our communities, and that's how we take decisions as a foundation, by taking all of that data and all of that information from our communities. Thank you so much. I think it's really important to highlight that if how we have this in the Health Foundation has this intrinsic value of how to obtain different programs and how to influence political changes without taking a political side, right? So that people in Colorado are able to better access better quality of life. And so I think you all are doing excellent work throughout the entire year, not just right now during the revision of the data, but you all do a lot of work behind the scenes, so to speak. And every now and a lot of people don't know about the work that you all do and the work that you all develop. You're you're right, Virginia. You have I agree with what you're saying. As an organization, as a foundation, we don't have any sort of we are a nonpartisan group. The only thing that we care about is how we understand the issues, and how there might be systemic issues that need to change or local issues, and how we're able to help our communities access programs or access services. And we collaborate with organizations in the area who are working towards working towards community engagement to better understand the community. And so we understand that this type of work, we truly want our communities to have a voice, and so that they're able to elevate their suggestions, and be able to be a part of the decision making process. So our work, more than anything, is supporting our community so that they have this role, this political role, so that they're able to have these conversations with decision makers and political leaders in the areas that they live in. So we're there as a support. Thank you so much for that response. And I think that works really nicely uh, as a way to identify the type of work that you all do and work that you represent. There's a question from the public. Was there any sort of difference in terms of ability levels of folks? Of physical abilities of folks. The question that we asked in terms of disability is if folks were living with different abilities, but we didn't get down into those specifics about those types of disabilities or different abilities in terms of mental or in terms of physical abilities or developmental abilities. No, I think you're right. We didn't ask specifically of folks' ability levels or in terms of specific names or anything like that, but we asked if folks had a disability or had a different ability. That was a question that we did, but not into the detail, the type of ability or disability. All of these comments have been really interesting, and I think the explanation that you've given, Enrique, in Spanish and along with our simultaneous English interpretation, I think that you've made this really clear in terms of what Latinos are experiencing in Colorado. Somebody made a comment that said, having all of this information, all of these worries about how our Latino community is living, where do we start after hearing all of this? Like, where are we supposed to start? Where can we kind of help so that these surveys have a positive result? I think that's really interesting because I think that this is something that we have seen and something that we is that there is definitely that kind of thirst to be able to find a solution or solution and be able to kind of present when we present this information. I think, we are able to kind of get this information as much as we can and share this information out, give access to this information, and then give folks a pathway towards solutions from what we see and from what we feel and what we've noticed in terms of other work that we've done. I think the important piece here is how do we present this information? How do we let people know that there's a different type of help for folks? Because what we have here in terms of, the path isn't clear for folks. And so we want to be able to present this information. We want people to know that there's different types of help. And I think that is something that we can provide.
I think that also, aside from this information, I think there are so many leaders in this virtual room that can actually do a change, enact change with their knowledge, with their collaborators, with their roots that they've developed in this society, in this community of Colorado, and with the wings that they've opened up, they have the ability to assist in deploying policies that can help all Colorado residents, regardless of whether they are part of a minority or not, because we all need help facing these concerns that you've talked about: cost of living, inflation, what happens with our children's education, all of these issues that we're facing in the future. So they might engage with these concerns and help in engaging with them. And so thank you for your response. And thank you also, I think, for the invitation from the Colorado Health Foundation to engage aside from Pulse as a survey. Maybe it's helpful for you all as a president or vice president of an organization to also count with people's help and ideas and gather ideas. Why not? To have the possibility of working with the rest of the people here. And Beatriz is also asking whether there is a report of all of these of all of the data and if there's a way to approach. So I'm going to repeat it. Do you do a report of all of the analysis that you have of the data, and is there a method to have strategies to work out strategies to face all these concerns? And I think, yeah, the report is what we're doing, what we've presented already, and then depending on how this information is used, then the way that people can use the instrument to be able to move forward and face and design certain measures. Thank you, Leslie. Well, thank you for the question. And as I was saying, the foundation considers all of the all the information that we can actually have access to from the community, from partners that work in different areas that can also help inform these decisions. And so when we have all of the data, what we do is how can we create an impact in society? So creating an impact that is not only from the foundation, the Colorado Health Foundation, but also an impact that is complementary, that can have a work with the leaders of the community, with the community-based organization. So with information like this that we've heard today, as we get this information, what we do now is to start to talk more internally about where we can find those spaces where we can create leadership in the community, and we can invest, for instance, having people of color to have those leadership roles in the way in which for them to express the way in which they have faced those challenges and how they can face the concerns. We want to be part of the construction of the leadership. We don't want to be the leaders ourselves, but we want the community to be the leaders, and we can assist them and work with them. You should also keep in mind that many of these conversations, sometimes we have to make decisions around that. For instance, this might not have to do with money, because it's not just about funding, but also about how many people or how many agencies out there are already doing the work and facing the challenge of building that effort. So we have to gather all of these elements, and as you might have heard and throughout the presentation, we have a commitment to equity and with racial justice. So this means that we'll continue to support these efforts and the community. Thank you so much for this response that's so organic. And I repeat myself, all of the people that are learning about these presentations and briefings, they're starting to understand how all of the parts come together, how they join, and how this puzzle sort of works. So Barbarita is asking, after getting these results, what's the next step? Partly Leslie just answered, but also I would like to highlight that each year we do the same pulse survey. This is the 4th year. Next year, we'll see what has changed in terms of experiences, expectations, concerns that we have as Coloradoans, but also we'll be sharing all of the data with all the political figures and community leaders, like Leslie just shared, to advocate for policies that can help answer to our concerns, to all of us. And we hope that you all as well, if you're a community leader or someone who's engaged and that has a power and has a voice of the people that you are all representing, that you use this data in conversation with the community. I don't know, Leslie, you want to add anything else to this, or Enrique? I think you covered everything, and Leslie as well. But yeah, I think that that's what we need to highlight, to use this as a tool and cover these topics, not just leave them on the side, but also we need to know that this exists, and having access to this information can help us strengthen ideas and projects and all the concerns that we're covering. Thank you, Enrique. And I also love this because this is very typical of Hispanics. So if this is the first time that you're coming to an event like this one, let me tell you that questions are always towards the end. Like throughout the meeting, we're very patient, we're very respectful, very quiet. I'm not saying that other communities are not doing this, but we have an ace up our sleeve, and so towards the end we have so many questions, and so thank you for honoring the questions and answers that people are expressing today. Beatriz Garcia is asking, or Elena, apologies, is there a plan for resolving these socioeconomic issues in our demographics? I would love to follow up from the survey, and that's why I'm asking. So Leslie, if this is okay, if you can share a bit about what the Health Foundation does, how to offer support, and how to, yeah, connect with community organizations. Thank you, Virginia. So the first thing that I would suggest is, please, if you can, if you're part of a nonprofit or a community-based organization and you're trying to push a project forward that's benefiting the community, please contact us. Every program official here in the organization would be happy to answer any questions that you have on grants and funding, but also walking hand by hand with you all about the process of how to offer funding. This can also be costly in terms of time and energy, because what we're hoping to do and have is to be involved with people and processes that one is in people that want to see different systems or a change in systems or how communities are working. We have different projects that go from opportunities for the community to get organized and face different issues that they have in their community based on them, on leaders, community leaders, and community facing the issue and what they think is best for them, from those kinds of projects to youth programs and youth problems. And so we can help you all depending on what your project is. We have bilingual staff that can have this conversation in Spanish and or in English, and we're also delighted to come to your communities and get to know you and your communities better. I think that the answer that you just offered, thank you, Leslie, so much, is covering already Patricia Miller's question that was asking about how is Colorado Health Foundation gonna invest their funds differently or their money differently. And so this is based on how we do these regular visits to what's happening in the community, how to take the pulse, how to do the survey. And you all, as representatives, you want to be in touch with those people that want to be in touch with you all and learn about how to keep in touch. Nancy Molina is asking, how does the Colorado Health Foundation helping people of color to strengthen their power in community? Do you want to speak about research, maybe, Enrique, and then maybe I'll switch to Leslie in terms of action? Certainly. How? So the question is, sorry, I had sound cut out. Can you repeat the question? Yes. How does Colorado Health Foundation helping people of color to strengthen their power or increase their power in terms of research in their communities? So in terms of research, it gives communities a voice. So people are being able to speak up and share and to be able to be part of the survey. So if at some point you have the opportunity and you want to be part of responding the survey, then you have a voice and you're able to say what's most pressing to you for you, what's your biggest concern at this point. And from there, I think these populations, these demographics want to help by answering the survey. I think that's what the Colorado Health Foundation can offer. And as you said, Virginia, we also go to action. So after we hear out people's voices, at that point, when they share their concerns, what's going on in the different communities and how they're being affected in terms of politics or economics, what we do then is we work with the community to start learning where can we invest. So we can invest in, or starting with people that get together in the community and that they want to develop a project, for instance, and they need to have more training on, say, leadership skills, or maybe they also need, because the value of each member of the community when we go to their meetings must be taken into account. So we cover food, or we offer resources so that so that they can bring their families, or childcare, and they don't feel like they have to leave their family because they're interested in resolving the issue, but they also have their own responsibilities at home. So we don't want to alter those sorts of things. And so these are some of the details where we want to invest so that they feel that full support, so that they can then take those leadership roles and they can execute and have conversations with other people that take decisions in higher levels or higher places. And so we do little things that might seem a little, that are not too big, but actually they help support each person to have that leadership role and the time to be able to invest it in doing this work. Yeah, and I just want to highlight something that Leslie is saying, is that that bit of having the trust, of being able to share, of being able to communicate and feel like they're worth it is so important, because one of the things that we feel is that sometimes we're not looking forward, we don't want to be talking about the topic, we don't want to be asking for more, or it's important for us to be able to highlight that, knowing that there are all of these different organizations that are in the community and have access to help each other and say, yeah, no, I mean, we can do this and we can talk about the topic and we can highlight it, because it can go beyond the concerns that we're going through. Yeah, sorry, and I just also wanted to mention something that, Indica, you made me think about fear, but also thinking that we are on our own. But when we create this space where other people can join, fear is then actually strength, because we start to have, it makes more sense. We're not the only ones that are thinking about change. There's other people that are thinking about change. And so the idea of community is gained by us investing in community. We want to create an identity and strengthen that identity from the community, but also shifting from fear to participation. Yes, because we're all in the same channel, in the same issue, so we're all on the same page. I like what you said, Leslie, thinking about strengthening community. It's what communities are. They have their identity, and they all have their identity. And I'm happy that the Colorado Health Foundation acknowledges this and realizes this, which comes hand in hand with what Kevin Vargas is asking when talking about cultural identity at the family level, was asking whether in the same household, whether they were more people.
No, we didn't ask directly. We didn't ask that question directly. That wasn't part of the survey, but it was one of the questions that I think when it came to housing, we asked if you had to share housing or share rooms. We did ask that, but we didn't directly ask if they were sharing, if more than one family was living in the same household. And I think with that, the other question, I'm reading the questions here as they come in, but in terms of the age, and we only surveyed people over the age of 18. We did not survey people under the age of 18. And so this is just kind of what I just wanted to kind of cover that. Another question here is, considering that the survey has been carried out for several years consecutively, what is any of the trends that you all have observed? Yes, this is a good question, and this is one of the things that I've seen, one of the trends is that the last survey was, during the pandemic, right? This is a topic that that was kind of the first time, right? And now we're kind of into the second draft of this, and we are talking about these economic concerns, housing, food, and to your point, I think it's interesting to see trends from 2020 to 2023. And so, yes, now that we kind of have these few years of data, we're able to share a more thorough analysis of the trend. And we're able to kind of share these tendencies or these trends over the last 4 years, things that have increased or decreased. And so, some of the things that we've noticed, we can definitely share that out. Yeah, I think it's important to highlight that if you all go into our interactive dashboard, where you can access this information in English and in Spanish, and you'll be able to see all of the year's data over the last 4 years where we've done this survey. And so we can definitely share this more and continue analyzing the data and how things have changed in terms of percentages with different topics, if we are noticing those trends. In that graphic, you're able to see as well the trends of the data. And in our interactive dashboard, you're able to kind of go over to the left side. You'll see on the right side, you'll be able to see a section that reads trends. And so you'll be able to kind of access that information as well. So thank you all so much for questions around the analysis of these patterns or of these trends. And you all can see, you can take your time and kind of go through the dashboard and be able to take that information, and you'll be able to hear all of the information that we already shared about our state. And there's a lot of those four large themes and then the kind of subcategories in each of those topics. So thank you, Mario, for that question. Any other observations, Leslie? I just want to reiterate the invitation to everybody who's listening to us today that if you all have any questions, if you all would like to talk more about any of the kind of topics or any suggestions that you might have, we are always open and available for an open conversation to address more of what's going on in our communities and talk more about what's going on. And we are here to represent you all as a community. We want to have those close relationships where we're able to have an open conversation. And if you all need to have more conversation about the topics in terms of grants or anything like that, please call us, write to us. It takes us about 24 hours to be able to respond to folks. But you all have at the Colorado you all, beyond having a friend, you guys have an ally in us as the Colorado Health Foundation. And we're able to help you all understand better what philanthropy is in Colorado and in the United States. And if there's anything that maybe we don't know or we don't have perhaps the reach to be able to make those investments, we're able to direct you to other allies, to other partners that might exist in our community who might be able to support you with those initiatives that we might not be able to support. And more than the philanthropic aspect that the Colorado Health Foundation has, you all have a wing that focuses more on organizations that are not nonprofit organizations. Is that correct, Leslie? I want to clarify. Maybe there's some folks who are here who are maybe asking themselves or wondering. So you all just support organizations that are nonprofit. Is that correct? Right. So when I mentioned earlier in my introduction, we support organizations that are nonprofits, but we also support other entities like universities, and we also support initiatives that come from the community, organizations that maybe don't have that 501c3 status. Perhaps are maybe pilot programs that have a fiscal sponsor, so that the fiscal sponsor perhaps takes more of the administrative burden. And we can talk more about this one-on-one for folks, but we have definitely made inversions or investments in organizations that are community-based, that have sponsorship through other organizations. So we've definitely been able to have those types of conversations, those types of contracts, And so please do not hesitate to reach out. Don't think that we only help organizations that have that 501(c)(3) status. We are able to invest in all types of organizations or groups, especially when we talk about thank you for that clarification. I think that's really useful. And for those of you who maybe are hearing for the first time about these efforts that the Colorado Health Foundation is taking on, we just want you all to know exactly what they do. So another question here is, what are you all doing to share these results with the community to better empower our residents to share the responses? I think the best response is, if you're kind of seeing this conversation, we're starting with these types of briefings and these types of presentations. We're able to share the data and this information with policymakers, with the media, and with our organizations that are in charge of policy making. And we want to remind you, just like Leslie said, if you're interested in additional briefings or additional conversations about Pulse in your community or your organization, please reach out to the foundation. Please speak with them, because the foundation is always welcoming your help and your ideas and your support in the community. I love Julieta Vargas's comment. She's given her information in the chat. If perhaps there's any folks who are needing mental health support for their families, please reach out to Julieta for help. I know that this is one of the topics that was most important to the Latino community, as well as the old communities, the white community, African American community, Asian communities. I know that mental health is a huge topic. One of the percentages from the poll, Latino women are 68% impacted by mental health issues compared to men at about 42%. That was really interesting to me that as Latino women, we are very impacted by this situation, the increasing cost of living, and all of the topics that Enrique talked about this morning, and Leslie as well. We'll have some contact information up on the screen before we wrap up this webinar. Thank you so much to everybody who's participated today. I'd like to give the opportunity to close out this session and give Leslie the opportunity to give any final words if there's anything that perhaps I didn't ask you. And then I also want Enrique to be able to close out his section as well before I close out the entire webinar. Go ahead, Leslie, you can start. Thank you, Enrique. So first, I want to thank each of you. I want to thank each of you for taking the time to listen to what is going on in Colorado, how these different decisions are impacting our communities, and how we can change these systems. But more than anything, I want to thank you all, because if you are here, that means that you're interested, that you have a commitment to the work that we're doing. And I want to highlight just again the invitation that we at the Colorado Health Foundation have our doors open to be able to hear more about the work that is going on in our communities and see more opportunities for collaboration. I'd also like to uh, point out that Austin shared some information in the chat. If you all are interested in knowing more about the Pulse survey, there's definitely more information there on the chat, especially if you want the presentations from today. That's something that's easily shared out. Again, thank you so much for the invitation, and thank you for allowing me to be part of this conversation. Thank you, Leslie. It's been a pleasure having you. Thank you so much for being the voice and the ambassador for the Colorado Health Foundation in Spanish today. And Enrique, I think, just re-highlighting the topics that we talked about today. This is a summary. This is a summary of the problems or the issues that we see currently as the biggest issues in our Latino communities in Colorado. This is more than anything a very valuable tool where you all can see, we today only touched on certain topics. And so this is just the tip of the iceberg, right? And so you all can get into the dashboard and see more results and more detailed results about other concerns, other issues that Coloradans brought up. And so this isn't, we, this is, just a little bit of information, but we want you all to use this as a tool. I think that it's really valuable, easy to navigate, and if there's any question that you all have, please feel free to reach out to us and we can enter into a bigger conversation. And if you're like me and you are left with even more questions and want to deepen this conversation, and please remember that you can review our dashboard in English and in Spanish at copulsepoll.org. copulsepoll.org. And through that website, you'll be able to navigate to our dashboard. You'll be able to see all of the information about different subgroups in Colorado. You'll also be able to get into the weeds as you want. And one thing that I heard today is that Pulse isn't able to respond to Pulse isn't the only way for us to be able to listen, right? There's many other ways to be able to listen to the needs of Coloradans. And so I want to remind you all once again that you all can continue listening in terms of what you all do with your organization, and that the Colorado Health Foundation is going to continue listening to you all and listening to all of our residents of Colorado. If you'd like to reach out, please don't hesitate to contact the Colorado Health Foundation. You can also communicate with Austin Montoya, our Director of Communication. Pulse is an annual survey, but we will see you all again next year and to do another one of these briefings. And so thank you all so much for your comments, your questions, and your suggestions through the chat today. I want to thank you all on behalf of the entire team that's behind me to take the fact that you all took a little bit of time to learn more about what's going on here in Colorado. You could have been anywhere else, but you took the time to be here and to educate yourself, and we want to thank you for that. Thank you. Thank you. We'll wrap up. Happy Hispanic Heritage Month. We'll see you all next time. Thank you.